Hello everyone, I'm Gonzalez. I'm project manager at the Fundació TIC Salut. We're one of the adoption sites of the project. I'm happy to share with you all the work that we have been doing these 2 years implementing this yellow button in the region of Catalonia. But first, let me give you some context. In Catalonia, we have this dual structure of care. On one side, we have the public system, where all the centers share one single medical record, one citizen app called La Meva Salut, where people access the health information. They can use the consultation services, and well, do many administrative tasks. And on the other side, we have the private centers, where the different private centers have their own health information system, their own citizen apps, and their own way of functioning, and none of them are connected to the public system. So experts and patients called for a better continuity of care. They wanted that the health information to be available to professionals who treat the patients. But today in Catalonia, this personal health information from the private sector is still not accessible to the public system, and not even between the private centers. So this is why we needed this new approach, one that puts the citizen at the center and allows them to control and share their health information whenever they want. So we started adopting this yellow button possibility with the yellow button to download this summary of medical data, because we identified that these different key needs, let's say. The first one was to ensure this high quality healthcare continuity, that the medical information can be accessible to professionals who treat the different patients. We wanted to enable this access to the personal data across public and private centers to support this personalized care and through this information sharing, and creating this new scenario of citizen empowerment, where the people could be able to move their data freely and decide who can access this data and under what conditions. So let's see the situation in 2023. To the next slide. So yeah, we had in the public sector, the Catalan Ministry of Health added, before the xShare project, this what was then called the blue button to the La Meva Salut app. So this functionality allowed the users to download their clinical data to share with other public health systems or research organizations, and allow citizens to become the owners of their health information. So they downloaded the document, the international patient summary, including diagnoses, treatments, vaccinations, allergies, and it could be downloaded through La Meva Salut, as you can see in the slide, in the XML format. And on the other side, in the private sector, each center had its own an independent system, its own citizen portal and its own rules, and most of them were not even aware of this functionality, and so this was not implemented at all. So this was the starting point in the project. So now let's go to the 2025 slide, please. Thank you. So after working closely with the Work Package 3 leaders, we defined the use case for Catalonia, for the region of Catalonia. To remember everyone, the main objective was to support this continuity of care between the public sector and the private sector. So on the public side, mainly what we did was working on the IPS format validation and compliance with the recommended guidelines. So now we can generate the IPS documents in in production environment and in FHIR, in the pre-production environment. And we are also working on enabling the upload of external IPSs into the La Meva Salut. And on the private side, we began collaborating with 2 different centers, Clínica Girona and Bufí. These centers had very different levels of maturity in terms of data structure and citizen apps. But well, despite this, we successfully implemented the possibility for patients to download the IPS directly from the patient portal. So we worked on this IPS format validation and compliance. So now we can generate also the IPS documents in both CDA and FHIR in the testing environment. And we also developed this IPS viewer app so that patients can easily read the documents and even view the APS files from different centers in the same interface. So this gives more understanding and better use of all this information. So we can go to the next slide to see the results of implementation. So in the public sector, we have recorded more than 160,000 IPS downloads in the CDA format in 2025 and more than 50 FHIR downloads. This difference is normal because, as I said, the FHIR download is in pre-production. But even though this is a very significant volume, and in the private sector, the testing phase resulted in 40 IPS downloads, 20 in each centers. So, and looking at the impact on the community, well, we identified many aspects. First of all, it's the patient empowerment. People now have the immediate and simple electronic access to their personal health data. We also detect a better quality of care. The IPS exchange supports more informed decision, ensuring this continuity of care. We also detect an improved safety because we are accessing to key information, like, for example, the allergies, reducing this risk during the treatment. And we also detected other very important aspects as the language neutrality. With this standardized information, we are overcoming the language barriers. And finally, also the European alignment and the legal and ethical security. So those are very important aspects.